Dr. Leisle, let's talk about the children with their teeth. How much does it have to do, like maintaining your first teeth? Because to a certain degree, and I remember that in my days, and that was obviously 50-some, 5-some, 6, 54, whatever. Anyway, a bunch 50 and more years ago, where I do remember that the emphasis on keeping your first teeth good and going to the dentist with it wasn't really there. I mean, if it hurt, Daddy took you to it, and I remember one incident. My dentist was also my MD. He was an MD/dentist. Keep in mind, I grew up in a village of 2,000 people. And in the old days, and I'm sure even today, that's not done anymore, not even in that village, but still, that there it was. And I do remember the guy, the dentist, he just hammered on the teeth, and the one where I went, that's the one he pulled out. Are you guys still doing that?
No. Thank God.
And I remember telling my dad, that's not the one, but that's not the tooth. And the dentist said, no, that's it. I know he says it feels different, but that's the one. And I said, no, that's not. And my dad actually flapped me one. Bing! He says, be quiet, the doctor speaks. And as the injection wore off, I think it was next day, or was it still the same? I think it was still the same day. Back we went to the doctor because it started hurting again, and it was the wrong tooth. And my father did say sorry.
That's good.
That's good. His education was even at that more than me, that you don't speak back to educated people. And I'm sure in absolutely now, new generation, we probably, including us elder, we probably speak back a little too much to educated people. We kind of want to make our own treatment plan. But that's all beside the point. Tell us how much one should take care of the first teeth. Do the first teeth have things such as a root canal? Should they be drilled? And why?
Well, it's very important. Thank you for asking me that, Helmut. It's very important to keep the baby teeth in the mouth. Sometimes parents come in with a conception that they should have, what's the use of having baby teeth? They're not going to come out anyway, so why try saving them with a filling or a crown or, like you said, a nerve treatment? Well, if you don't have the teeth, if you don't take care of them when they're a filling, then they become a crown. If you don't take care of them when there's going to be a crown, then they become a nerve treatment. If you don't take care of them, they have to be taken out. The problem is after they're being taken out.
The point is, why not take him out? In 2 years, he comes out anyway.
Well, if it's a 2-year-old child and they have back molars that have lots of decay, they're not supposed to lose those teeth until they're 9 to 12 years of age. And if they lose them early, then they're going to need to have expensive space maintainers made. Or if they don't get the space maintainers made, then they're going to have very expensive $6,000 to $8,000 orthodontics needed. And so you may need orthodontics, but why make the situation worse because a tooth wasn't saved or because you didn't do a filling in the very first place? So prevention, obviously, is the best thing. And if you can't do that, if the prevention was not done and there are some cavities, get them taken care of when they're small instead of them becoming expensively large.
Okay, I see. So basically, yes, those teeth come out, they will be gone. But they already can wreak havoc if they're not there. And of course, they hurt just as much if they break down, right? I mean,
and pain is a whole other issue. Whereas a lot of times children aren't eating right. If they're school age and they're not able to concentrate because they're having pain in the teeth. I have many children because most of my practice, 55% of my practice is 3 and under. But the school age children I have coming to see me, a lot of times they don't tell the parents they're having pain. And so they're having problems at school. The teachers are wondering why they're misbehaving. And sometimes it isn't always that way, but sometimes it's because they're having so much pain, they're acting out. And so a lot of times I always ask the child, so which tooth has been bothering you? Because sometimes the parent doesn't know, or the parent doesn't even realize the child's having pain.
Okay. All right. And okay. And what have you seen in terms of children? If they have, especially in front, if their smile isn't quite as nice as it could or should be, are children at young age self-conscious in school, in kindergarten, and are they getting teased by other kids if they have like, oh, you have that missing tooth, you look funny type of thing?
In kindergarten, of course, kindergarten, first grade, many children are missing teeth, so that's not a problem. But in preschool, sometimes the 3 and 4-year-olds can pick on each other because you look different than me. Generally, that's more of an adolescent thing. You know, when kids get in adolescence, they start sizing up who's the different one, who's the odd one. But in the 4-year-olds and 5-year-olds, missing teeth is not a big a deal. In fact, the younger ones, the 3 and 4-year-olds, they like to have the crowns. They like to have, you know, stainless steel crowns or white crowns. They like to have the jewels in their mouth. We call them jewels. They like to have the jewels on the teeth, or we call silver stars for the fillings in the back. They like having silver stars. But it does. They have challenges in school sometimes with other children.
Okay. So, and again, I guess it's just like with teaching a young child to dress proper for the occasion, to dress basically clean, and realize that dressing is a matter of, you know, you can change your appearance, and can make you look, whatever, happy, spanky, you can, you know, whatever it may be. And, and very obviously a good-looking mouth goes with it. So I guess it's like you educating a child from the begin to be presentable and to do everything, you know, to make you presentable. And that means taking care of, body parts, no different than of, a shirt.
That's right. And then they start looking up, well, I need to brush my teeth, Mom. And they'll say that to sometimes the parents or Dad, you know, because dads need to be involved also.
Mm-hmm. Right. Okay. Well, thanks a lot. Yes, you've got to go and maintain, keep, and work on your baby teeth, even though they come out. But while they're there, apparently we have them for a reason.
And it saves money.
Good.
Thank
All
you.
right.